4.5 million Filipinos aged 18 to 85 suffer from chronic pain.
Pain is the major symptom why a person will go to a medical doctor. It is a major problem worldwide, and even in the Philippines, we actually approximate 4.5 million Filipinos suffering from chronic pain.
If you ask patients, actually pain is the most common reason why they seek medical attention. And if you look at all the data that the patient will present, pain is the most distressing among all of the symptoms. Pain is defined by the International Association for the Study of Pain as an unpleasant physical and emotional experience, usually associated with actual tissue damage, so something's going on, or even just potential tissue damage. Pain actually sometimes has protective function because acutely it tells you that something is going on in your body. So it drives you to seek medical attention. But at times it can become chronic. That means it persists unrelenting. Then this time it doesn't have any function at all.
There are also those patients who suffer from acute pain, and therefore our center sees both acute and chronic pain. The problem with chronic pain is that it does not show as a very intense pain, and a lot of physicians will have the misconception that this is not painful. So chronic pain is actually one of the things that we see in the Pain Management Center.
Pain is a major symptom in many medical conditions. It can significantly interfere with a person's quality of life and general functioning.
It's important to manage pain properly because we know that those patients with good pain control, they recover faster, there's less complications, they respond to treatment better.
Chronic pain also carries great economic impact, both direct and indirect. So a patient with chronic pain might not be able to go to work, and this will have a very bad economic impact on his family. So we have to treat pain, and a lot of time, pain is disregarded by most patients and as well as physicians.
Pain is multidimensional. It not only affects the physical well-being of the patients, but also the emotional and the psychological well-being. So it's very important for us doctors to tease out all of these factors because we want not only to control pain, but we like to improve the suffering and the quality of life of the patient.
The St. Luke's Pain Management Center offers a comprehensive range of services for patients suffering from acute or chronic disabling pain. It offers the most advanced treatment options currently available with the combined expertise of a multidisciplinary team of pain specialists. Patients' conditions are diagnosed using the latest diagnostic technologies and treated with individualized medical, physiatric, psychological, and interventional therapies to help patients achieve their optimum level of functionality.
The Pain Management Center of St. Luke's was established in 1992, and it is the oldest pain management center in the Philippines. This is a multidisciplinary pain center, and we have around 17 specialists only trying to solve the pain problem. We have psychiatrists, psychologists, neurologists, anesthesiologists, even orthopedic surgeons, and rehab doctors. The problem of pain cannot be fully solved because a lot of patients are afraid to take medications, and this is a fact, especially if we are going to introduce opioid medication. So we try to educate the patients with the drugs that we're using. Every time a patient comes in, educational materials are actually being given to the patient in order for them to understand what is the problem of their patient, what are the causes of their pain, and what are the possible drugs that we can actually introduce.
We are very fortunate that we were able to gather top-notch pain specialists in different fields of medicine to create this multidisciplinary group. We have someone who is in charge in acute post-operative pain, and she's really trained in acute pain service in University of Wisconsin and at Memorial Sloan Kettering Cancer Center in New York. We have someone who will offer palliative care, so this is the service that we offer to patients, and she actually trained in Sydney Institute of Palliative Care. And we also have an interventionist. So this is the intervention that we use here in the center. Is we have celiac plexus block, we have neurolytic blockade, spinal cord stimulations, She was trained in Royal North Shore Hospital in Sydney. And we also have one who is trained in pain in pediatrics, in children. Also trained in Children's Hospital at Westmead in Australia.
Patients at the St. Luke's Pain Management Center are cared for by a multidisciplinary team of pain specialists.
Our pain management team is multidisciplinary, so we cannot solve the problem just by seeing a patient alone. If there is a need for another doctor to come in, we really have to have another or a third doctor. So most of the time, a complex pain cannot be solved by one physician. So it has to be a multidisciplinary approach. And this is done through a conference, and we try to evaluate the patient from different points of view. Consultants were trained both here in the Philippines and abroad, and most of them are known in their fields of specialty.
Yes, we have the most number of pain nurses in the country. So far, we have 14 dedicated pain nurses who will make sure that all patients in the hospital have good pain control. We are the only hospital in Southeast Asia, I guess, who has this policy that all patients with moderate to severe pain will be automatically seen by the pain specialist, by the pain service, to assess and manage their pain.
Well, the patient's safety and the relief of pain are two of the things that we have to consider, because patients who are in severe pain must be relieved of their pain. And this is very, very important, especially a patient with long-lasting pain has to be given attention, and they have to be given the right drugs and medication.
The St. Luke's Pain Management Center, harnessing multidisciplinary expertise and the latest diagnostic and therapeutic methods to help patients live a life beyond pain. Ultimately, it is expertise.